it's Mindy Totten at bodyworkmastery.com. Today we are going to continue our series on the cranial bones, and we're going to talk about the frontal bone. We're going to start with some background information and review placement, then we're going to look over the technique, and then talk about some common mistakes that folks make. So starting off with the frontal bone, we have the Jester here. Several of you have asked why I call him the Jester. Maybe you know, maybe you don't. I used to be an English teacher for years and years and taught Hamlet many a time. And there's a part in Hamlet where the grave diggers are digging up graves and they're throwing skulls out. And one of these skulls, I know, a total nerd. One of the skulls rolls out and Hamlet picks it up and he sees that it's his old court jester and his name is Uric. And he says, "Oh, Horatio, I knew him once." So that's why I call him the Jester. Yeah, sorry you asked, right? Anyway, on the Jester, you can see that the frontal bone is here in this beautiful turquoise color. So a mistake that lots of people make is that we think that the frontal bone just ends right here at the hairline. But if you look closely at the Jester, you can see that it goes quite a ways back. Right, back into almost the center of the head where the coronal suture where it articulates with the parietal bones of the coronal suture. So remember, first thing is that the frontal bone is really quite big. Another thing that people tend to forget, so here is a disarticulated frontal bone. See how big that is? Right, so the hairline would just go to like little, like here, but there's this much more of the frontal bone. So when you're placing your hands on there, on a person's forehead, remember that the frontal bone goes quite a ways back. And people forget, we'll go over the technique in a minute, but the main thing they think of is osseous restriction release. So if there's any bony restriction, that you're lifting the frontal bone to release that. But folks forget that there's another part of the intention which has to do with the intracranial membrane system. So remember this guy here. This is the intracranial membrane system, and this beautiful half circle here is called the falx cerebri. Falx means F-A-L-X. Falx means sickle, so you can remember that when you're looking at this sickle. Falx cerebri, and this little bit down here, the falx cerebelli. Okay, so the frontal bone, it attaches inside the frontal bone here, midline in the frontal bone. So if the person is laying on the table, right? Let's see if you can get that. There, the person's laying on the table. Here's their forehead. Here's the tops of the orbits of their eyes. Here's the foramen magnum at the top of the dural tube going down the spine. So the first part of the technique, the first part of the intention is to release those bony restrictions, those osseous restrictions. But the second part of the intention, if you lift anterior, in this case up towards the ceiling, what you're doing there is stretching this falx cerebri and a little bit of the falx cerebelli in an anterior motion. So you're stretching, releasing, mobilizing the falx in that direction. All right, so when we get to the technique, what you do is you place your fourth finger here, follow from the midline and follow it down until you feel this area right here. It's called the lateral ridge of the frontal bone. And you place your fourth finger posterior, meaning closer to the table, there on both sides. Let's see here. So you follow it down. Don't stick your eyes into people's eyeballs like I just did. Fingers are here, follow down, fourth finger on the lateral ridge, and then you drape the other fingers over the forehead, over the frontal bone. Now I've seen some instructors, this is the way that I do it. I drape the rest of my hand on the back of the frontal, being careful not to go onto the parietal. I've seen some instructors teach it with their fingers over the orbits of the eyes. Wonderful, but if you do that, be careful not to do what I just did and stick your fingers in the poor folks' eyes. So you've got your hands in this position here, and then you gently, using your supersonic super glue of intention, you're going to lift the frontal bone anterior towards the ceiling. So here's the Jester. I'll just do one hand here. Frontal bone in place, fingers in place, and gently lift towards the ceiling. First part of the intention is to release osseous restrictions, bony restrictions. Second part is to stretch that falx. Now, mistakes that people commonly make, one is that they're too heavy on the frontal bone. And if you've never done this, I invite you to take a nickel, which is about 5 grams of weight. Take the nickel, and you've practiced probably putting it on your hand, seeing how heavy that is, putting it on your arm, seeing how heavy it is. Take the nickel and put it on your forehead. You will be amazed at how much heavier that feels. And that really helped me get an idea of how heavy my pressure needed to be here. So light, light, light on the forehead, on the frontal bone. And then the second mistake folks make is that they squeeze medially, they compress medially. So they try to pick the frontal bone up like this. Don't do that. Just let your fingers rest, drape very, very gently, and then use your supersonic super glue of intention to gently lift the frontal bone towards the ceiling. Sometimes I think of it as that supersonic super glue as, when you have like a stamp and you can't pick it up, you lick your finger and you put it on the stamp and then it comes up. Right. That really helped me get a sense of what the frontal lift should feel like, what that's all about. So a couple of tips for your frontal bone. Practice, see how it goes. If you need some more support, there are a couple of links below for bodyworkmastery.com, their programs. And if you have any comments, please be sure to put them down there. I'd be happy to answer any questions you have. And if you'd like to subscribe, we'd love to have you on board. Again, it's bodyworkmastery.com. I'm Mindy Totten, wishing you love, joy, and a wonderful journey.